Hello and welcome back to Cornerstone Advanced Training. Interested people on learning how to use systematic approach, which we have started a couple of videos before, and we proceed and completed the use of initial assessments and primary assessment. In conclusion, I would like to remind you what did we cover? We have covered the initial assessments to identify if the child possibly need a life-threatening intervention using a basic life support or not life-threatening condition, which we can proceed with the ABCDE ALS approach. So during the primary assessments, we were able to identify which system is causing problems, how severe it is, which category of problem it is, and possibly what are the differential diagnoses. On the way completing this journey, we have found some problems which we treated the problems. So then we reached to the point to collect the history and perform the physical examination. So how do you manage that part? It also needs the skills of communication skills from the providers, because it is an interaction between the providers and the family members. The family members, not all of the family members are not the same. Not everyone giving you the information what you want. So you need to know how to collect the information, how to collect the history. One of the things which you did during the primary assessment to help yourself to be able to use the information from the family member was you already set up the differential diagnosis for yourself. For the example, in a previous case, if you remember, our case was the case of upper airway obstruction, possibly foreign body aspiration, possibly croup, or possibly anaphylactic reactions. So now you want to know which one of these three are the most likely problem for this child. How do you start with? So I'm sure you all know the step of using the secondary assessments using the mnemotic of sample. S, A, M, P, L, and E. So the S stands for signs and symptoms. A stands for allergy, M stands for medications, P stands for past medical history, L stands for last meal, and E stands for events lead to this situation. How do you collect the signs and symptoms? It's not logic to ask parents, what are the signs and symptoms? Not every parents know what do you mean by signs and symptoms. You have to verbalize the signs and symptoms which you have already defined. You may explain for the parents by describing the situation which you can see and ask further from the parents. So tell them, for example, I can see the child is breathing fast and there is a noise on breathing. Is there anything else you can tell me? So they might tell you about something which is not visible right now. For example, the child have an episode of vomiting. For example, the child have coughing or running nose, which is at the moment you cannot see it. So by collecting the signs and symptoms, you can proceed to ask about the allergy. As long as in the pediatrics we are covering the age of infant up to the age of the puberty, some of the infants are too small to have the past history of allergies. So when you ask about the past medical history and past allergy, you have to also about the family history of the allergy. Maybe this is the first attempt of the allergy. So if you are sure the child has no allergy or you already identify the type of the allergy, the next question is the medication. So is the child on any specific medications or not? If yes, what are the medications? If no, the medication, did he use medications or not? If yes, what was the dose of medications? Did he use a correct dose or not? Or did you miss any doses or not? The next question is about the past medical history. The past medical and surgical history can also help you to identify, by the way, we should not go away from what we have already planned and identified during the primary assessments. Remember, you have only 3 differential diagnoses, and whatever you are collecting now, it should help you to determine or to rule out or rule in one of those 3. So you can ask about the past medical history, recent medical history, or past surgical story. So after that, asking about the last meal is important. We should not skip any one of these assessments. The last meal, what do you want to know? It's not a matter of what kind of food he has. It is mostly about how did he tolerate the food. Is he having a good appetite or not? Did he miss to eat food or not? If he missed, why? Is he not willing to eat, or he is unable to tolerate the food, for example? He is vomiting. He keeps vomiting, that's why he is not willing to eat. Or he is all the time sleeping. So he is not eating because he is all the time sleeping. Or he ate normal. Or he ate long time before. Whatever it is, the information will help you. And finally, about the events. So what was the events leading to this situation? At the end, you can keep the area open for the parents to tell you what they want to say. By the way, sometimes giving the parents open gate, they talk a lot. So you have to be careful about collecting the information only what you want, and don't be misled by parents with the wrong information. All the parents are trying to give you the correct information, but sometimes over information and sometimes missing the information intentionally or non intentionally. We have to be clever and we have to know what we want. So after completing the history part, probably you reach to your final diagnosis. If not, or even if yes, it's a time to move to the second part of the secondary assessments. Before we move forward to the second part, we will recheck the vital signs of the child, because you have already started some intervention during your primary assessments. You remember, we have started oxygen, we have started ventilation, possibly we have started IV fluid therapy for the shock patients. And now we want to see how it worked. Did the perfusion improve or not for the shock cases, for example? We reassess the vital signs and intervene if it is needed. If you identify the patients deteriorating, possibly you are giving a wrong intervention and you have to revise your actions. After rechecking the vital signs and recorded, it's a time to check the head to toe examination. So you will start from the head to toe examination, including head, eyes, ears, nose, throat, neck. Look and deeply assess the head, eyes, ears, nose, throat, and neck, and see if anything can help you to identify your final diagnosis again. So I'm not again going deeply to the assessments of the head, and then neck, and then chest. On the chest, what do? We have earlier auscultated lung sounds. Do you remember? During the primary assessments, breathing assessment, we auscultated lung sounds. So upper and lower sides of the lungs. And now it's a time to assess the heart sounds. As well, we reassess the lung sounds to see if IV fluid we have given has overloaded the child or not. The heart sounds also can give us an information. Either you have a gallop rhythm, you have muffled sounds, you have normal sounds, or you have any other type of abnormal heart sounds, which probably we know what should we do in each one of these abnormal heart sounds. So the next action is to move to the abdomen. What am I looking in the abdomen? I'm checking for the size of the organs, especially the liver and the spleen, and the abdomen itself. So do you have a soft abdomen or it's tender? Do you have distended abdomen or it's flat? Do you have organomegaly, such as hepatomegaly, splenomegaly, or no? The spleen and liver are in a normal size. So this again will help you to determine if possibly the child has cardiogenic shock. So that will be also associated with abnormal heart sounds, and it might be associated with the distension of the jugular vein. So the next is to check the pelvic, and the next is to check the extremities, and the next is to check the backside of the child, and finally about the level of consciousness and the nervous system. So by completing the head-to-toe assessments, you should be able to finalize your diagnosis. In some cases only, you may need to move forward for additional investigations, such as echocardiography, CT scan, or sonography, or etc. So, which is additional investigation that is categorized under the category, the fourth category of assessment, which is tertiary assessments. So far, we have covered all level of the systematic approach, starting from initial assessments, primary assessments, secondary assessment, and tertiary assessments. Once more, I'm going to recap and inform you and remind you what are the objectives of each one of these levels. The objective of performing the initial assessment is to identify either the case is a case of life-threatening or not. If not, I'm moving toward checking the primary assessments. The objective of identifying and performing the primary assessments is to identify which system is causing problem, how severe is the problem, which category of problem it is, and what are the differential diagnoses. So I should be able to move forward to the secondary assessment. The objective of performing a secondary assessment is to finalize the diagnosis which I have been identified during the secondary assessments and reach to the conclusion of the diagnosis. Again, reaching to the diagnosis is my last goal during the PALS performance. Pediatric advanced life support emphasize on identifying the problems and solving the problems versus finalizing the diagnosis. During this journey, there are several times we might need assistance. We might need help of experts. How do I know whom to call for help? How do I know whom to approach? Who can help me? So who is the right person to help me? This is also included the expertise which we expect the PALS provider to have. So the PALS provider job is not to be a master of performing everything for the patient by self. You have to consider the teamwork and multidisciplinary performance. So there are different experts around you, which you can reach them, which you can approach them, if you know whom do you need, if you know what's the problem. So if you are suspecting, for example, the child has cardiac tamponade, so you know whom to approach. So you cannot perform a pericardiocentesis for the patients if you are not a cardiologist, or if you are not an intensivist, or you are not trained for that. But you are able by certifying with the PALS, you are able to identify this is a problem. And this is the reason the child is suffering. This is a reason the child is in shock. The shock is due to an obstruction around the heart, which is the collection of the fluid in the pericardium. So what should I do? I have to relieve this one. Me? No, the expert. But who should call the expert? You. That's why we need to train on identifying the problems and either fix it by yourself or approach to the right person. So I hope this 3 video is going to help you to get a proper impression and knowledge about the use of systematic approach. There will be an additional video to go deeper to each assessment, which is coming soon.